California is now struggling through one of its worst waves as the state tops 6 million cases since the beginning of the pandemic, the most of any U.S. state. This comes as the daily case average lifted to nearly 60,000 over the past 8 weeks, according to data from state officials. For more, let's bring in ABC News medical contributor and board-certified emergency physician, Dr. Darian Sutton. Thanks very much for being here, Doctor. It's good to see you again.
Good to see you as well.
And we count cases, but there's more to this story than the number of cases. And I want to ask you about this new study, which I'm sure you've seen, reviewing medical records of nearly 70,000 patients in California. It found that an Omicron infection cut the risk of being hospitalized in half compared to Delta. In other words, Omicron is less severe. Tended to have shorter hospital stays as well. So with the CDC now estimating Omicron to be responsible for about, almost 100% of the new cases, what does this mean?
It means what we've been seeing, and it's reflecting what we've been seeing around the world, specifically in the UK and in South Africa. We have seen that this variant is associated with shorter hospital stays and a decreased probability of a patient requiring advanced care, like being placed on a ventilator. But it's also likely a combination of the benefits and advancements in the treatment of COVID-19, as since COVID-19 has come out and comparative to prior variants, we have gotten better at understanding the progression of disease. We've gotten better in the treatments, and obviously we've gotten better at providing vaccinations to all of those who are eligible. And this is probably a combination, the results of these outcomes are probably a combination of these two or a couple of these factors.
Got it. So we're doing a better job, and this is a slightly different variant of the virus. So in California, the state officials there are attempting to address staffing shortages through a sweeping policy change that, as I understand it, allows asymptomatic healthcare workers who've tested positive for coronavirus to return to work immediately without isolation or testing. If one is still contagious, even if one is asymptomatic, is that a good idea?
I can feel what your sentiment is on this, Terry, and we're on the same page. We're currently at a dire situation here in Southern California, and these recommendations and adjustments speak to how critical this situation is. We don't have room for patients to be placed once we admit them. We don't have staff to take care of these patients. The volume of people that are coming in secondary to this current surge is just not sustainable for the hospital. Anyone actively infected with COVID-19 poses an increased risk of transmitting that virus to those around them. And although someone who is asymptomatic and wearing an N95 mask can decrease that risk of transmission, it does not bring that risk down to zero. So I'm hopeful that this recommendation is strictly for crisis standards, which unfortunately we are in now. I'm hopeful that this ends quickly. But if you're listening and watching this and you're trying to figure out how you can help by, of course, getting vaccinated, making sure that you wear your mask, and trying to decrease transmission as much as possible, because like I said, this amount of the volume of patients is just not sustainable.
And you're living it right now, this emergency situation. I want to ask about the denominator, the so-called denominator of COVID under Omicron. In other words, one's risk of getting hospitalized or having a bad result with COVID is sometimes expressed in percentages, but we don't really know how many cases there are because some of them are asymptomatic. And preliminary findings from 2 South African clinical trials suggest that the Omicron variant has a much higher rate of what they call asymptomatic carriage than earlier variants.
Yep.
So what is that?
Yeah, so these 2 studies, the primary goal of the 2 studies actually was to look at the benefit of mRNA vaccines in patients who have well-treated HIV, and they essentially basically created these data points to look at what the outcomes of COVID-19 look like now versus prior variants, and they saw that there was an increased percentage in the amount of patients who had an infection but had no symptoms at all, approximately 10% higher compared to last time. So what does this mean? It probably speaks to the fact, or adds to the reasoning behind why this variant is so much more transmissible, simply from the fact that people are probably walking around unknowingly transmitting it from one person to another, which is why surveillance testing is such a crucial part of those mitigation efforts, so that people know their status and act accordingly.
All right. Well, Dr. Darian Sutton, we thank you for that, and thank you for what you're doing out there. And we hope things calm down when it comes to COVID out in California. Good luck.
Thank you so much, Terry. Me too.
Thanks.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.